So once we collectively talk about some other, bones of the skull, okay, or will you say bones of the head? Okay, so sometimes when you say cranial, when you talk about cranial, most of the times you could be discussing plus bones of the face. Do you understand? But if you are being strict, you say bones of the skull, you discuss them differently. Bones of the face, you discuss them differently. Then you have the neck. You understand? So it's head, neck, and face. Do you understand? To be strict. So cranial bones will actually discuss them plus the bones of the face. So there are 8, and they form the protective case around the brain, known as the what? Neurocranium. Okay, we are not discussing them with the bones of the face. We are not discussing them with the bones of the face. Okay, it's just the skull, cranium. Okay, I felt I included the bones of the skull too. So these are the bones. Okay, in real sense, you have about 5 bones. Do you understand? But it could be that some are paired, so you're having it 8. So note the number. Okay, it could actually be an exam question. So we have the frontal bone. That's the frontal bone. It forms the forehead and the roof of the orbit, and also part of the nasal cavity. We have the parietal bone. Okay, parietal bone is at the side. So you have one at this side, one at this side. It's paired. Okay, so it's a large bone. It forms the side and the roof of the skull. Then we have the temporal bone, which this one is located at the base of the skull. So that one is also paired. So temporal bone is at the base. So this is a frontal view and a side view. So the side view, you can actually see the temporal bone properly. So temporal bone is going down, so it's just below the parietal bone. Do you understand? Then we have the occipital bone, which is actually at the back. You can see occipital bone. I didn't use this image, so let's start using this image. But this image is at the front, so you can't actually see the occipital bone here. Okay, you can't see the occipital bone here. Then we have the sphenoid bone. Where's the sphenoid bone? Right here. It's kind of like behind your eye. Do you understand? See, sphenoid. Okay, behind your eye, but you could actually see that the side, just behind the eye. Do you understand? Then ethmoid bone. Where's the ethmoid bone? This one is actually inside your eyes, but at the side where your eye is kind of like coming in contact with the nose. So each of these bones, we'll get to talk about their individual anatomy, so you guys don't have to worry much. Okay, so that's what we got. So basically they enclose and protect the brain. They provide attachment points for the facial bones and muscles. They contain foramen and canals for nerves and blood vessels to pass through. They house sinuses that lighten the skull, some kind of like air pores, so they help to like lighten the skull, and they aid in resonance. So clinical notes: cranial bones are joined by immovable bone joints, so you can actually move those joints. So in infants, the soft spots are called fontanelles. So they allow the skull to keep growing. They allow the brain to keep developing. So if there's any trauma to the cranial bones, there is now a risk of your brain getting affected. Do you understand? So that's why we actually study the anatomy. So the next lectures I'll be following will be more of like, we'll be talking about each of these cranial bones, get to talk about them one by one and get to look at their anatomy, their shapes, and all of that.